Libertarian ethics in healthcare. When healthcare professionals debate ethical obligations, a central question often emerges: who has the right to decide? Libertarian ethics places that question at the very center of moral reasoning. Libertarian ethics is an ethical framework that emphasizes individual liberty, self-ownership, and freedom from coercion. It holds that individuals have moral authority over their own bodies, lives, and property, and that ethical action requires respecting that authority above all else. In healthcare ethics, this translates into a strong emphasis on personal choice, informed consent, and minimal interference by institutions or the state. From a libertarian perspective, ethical legitimacy arises from voluntary action and consent. Actions are morally permissible if they respect individual freedom and do not involve coercion, force, or deception. The primary moral constraint is the non-aggression principle. It is ethically wrong to initiate force or coercion against others, even for ostensibly good ends. This approach is often associated with political and moral philosophers such as Robert Nozick, who argued that justice consists in respecting individual rights rather than promoting particular social outcomes. While libertarian ethics is not limited to healthcare, its implications for medical decision-making are significant. In healthcare ethics, libertarian reasoning strongly supports patient autonomy. Individuals are seen as the rightful decision makers regarding their own bodies, medical treatments, and risk tolerance. From this perspective, healthcare professionals have an ethical obligation to respect patient choices, even when those choices conflict with medical advice or population-level goals. Informed consent is therefore not merely a procedural requirement, but a moral cornerstone. Treatment without consent is ethically impermissible because it violates self-ownership. Even well-intentioned paternalism is viewed with suspicion, as it substitutes institutional judgment for individual choice. Libertarian ethics also shapes views on the role of the state and institutions in healthcare. Mandates, compulsory treatments, and enforced redistribution of healthcare resources are often seen as ethically problematic because they involve coercion. Ethical healthcare, on this view, should prioritize voluntary participation, free exchange, and respect for individual rights over centralized control. This perspective becomes especially visible in debates over public health measures, vaccination mandates, end-of-life decisions, and access to experimental treatments. Libertarian ethics asks whether individuals are being forced to act against their will, even if such force is justified by appeals to collective benefit. In healthcare systems, libertarian ethics challenges the idea that outcomes alone justify intervention. Even if a policy improves overall health statistics, it may still be ethically objectionable if it violates individual liberty. This places libertarian ethics in tension with consequentialist and some public health approaches. At the same time, libertarian ethics does not deny moral responsibility. Individuals are accountable for the consequences of their own choices. Freedom and responsibility are inseparable. Patients are free to refuse treatment, but they must also accept the outcomes of that refusal. This framework also raises important questions about access and justice. Critics argue that libertarian ethics may inadequately address inequalities in healthcare access, as it prioritizes freedom over redistribution. From a libertarian standpoint, however, ethical obligations are limited to respecting rights, not guaranteeing equal outcomes. In your healthcare ethics framework, Libertarian ethics helps illuminate why autonomy is often treated as a near absolute value in clinical practice. It explains resistance to coercive policies and highlights the moral significance of consent, choice, and bodily sovereignty. At the same time, libertarian ethics exposes ethical tensions that healthcare professionals must navigate. Absolute respect for individual liberty can conflict with duties of beneficence, non maleficence, and justice, especially in situations involving communicable disease, vulnerable populations, or shared resources. For this reason, libertarian ethics is rarely applied in isolation in healthcare. Instead, it functions as a critical lens that guards against overreach, paternalism, and moral complacency. It asks whether healthcare systems are respecting persons as owners of their own lives or merely treating them as means to institutional goals. Libertarian ethics reminds healthcare professionals that ethical care begins with respect for freedom. It challenges the assumption that good intentions justify coercion and insists that moral legitimacy requires consent. Understanding libertarian ethics is essential in healthcare because it clarifies why autonomy matters so deeply, why coercion is ethically fraught, and why respecting patient choice is not merely a courtesy, but a moral demand rooted in the concept of self ownership.